10,000 Americans die every single week due to diet-related diseases. And our approach to food in this country creates 21,000 new diabetics every week. And diet is the cause of 45% of all cardiometabolic deaths. Well, good afternoon, everybody. I'm pleased to be here. I'm the co-founder and CEO of Epicured. Our company has become the leading food as medicine company for the healthcare industry. And we're here today to both engage with investors to fill out our Series B capital round and to, as always, seek out new clients. Unfortunately, our society is sick and the food we are eating is literally killing us. 10,000 Americans die every single week due to diet-related diseases. And our approach to food in this country creates 21,000 new diabetics every week. And diet is the cause of 45% of all cardiometabolic deaths. Besides the terrible impact it has on the lives of millions of Americans, it costs us all 1.1 trillion annually. Yes, trillion. The root cause is also where we find the solution, luckily. Let there be no doubt that nutrition interventions are proven to improve health outcomes and reduce costs. The problem is so big that the White House itself has launched a government-wide program to integrate food as medicine into healthcare delivery in the United States. At the tip of that spear is medically tailored meals, which is the service we provide. But before we get to Epicured, let's cover why medically tailored meals are so important to the future. It is proven, again, that medically tailored meals can reduce 49% of hospital admissions and reduce net overall healthcare costs by 16%. When you look at individual disease state ROI and efficacy metrics, both on a per member per month basis and on a symptom or condition basis, the results are compelling. Historically, the challenges of deploying food as medicine have been myriad, particularly because healthcare and food historically have been at odds with each other, and who actually wants hospital food? Diet compliance is complex and the food doesn't taste good. The experience is institutionalized, treated as a cost center, and not designed for the end user. Chronic disease management is not managed in acute care settings, but on the go, in the home, and in the workplace. And we have a big access issue where unreimbursed or under-reimbursed care exacerbates social determinants of health. The healthcare industry needs new partners to overcome these historical challenges. Medically tailored meals are working, but there's not a good way to actually deploy. And that's where we come in. We founded Epicured to translate scientific research into high-quality, cost-effective, medically tailored food products for individuals and the healthcare industry. We translate, we design, we produce, we distribute, and we conduct further research with clinical partners around the world. Our food is beautiful, and it's medically tailored, that meets clinical guidelines, that clinicians are proud to prescribe, that we deliver the patients food they want to eat, that makes them feel better and is culturally appropriate. And we're omni-channel and omni-wallet, whether in the grocery store or shipped directly to the home, fully prepared meals ready to eat or reheat and eat, or CPG, meaning consumer packaged goods. We design our product to fit into the daily lives of our consumers, many of your patients. Our business model is that we wanted to make sure we can maximize our impact. To achieve our mission, we built our own healing food center to ensure we had control and agility in partnering with our clinicians and patients to design solutions that met the need. To start, knowing neither the industry nor us as a company, about 7 years ago, were ready for full-scale reimbursable contracts. Similar to what Jamie just said about Julie Yu, we went to market in a self-pay basis with a clinical network. We were then invited by leading wholesalers to stock our products on their shelves. That was inbound demand. And now more and more, we're seen as nutrition as a service for a growing enterprise clientele. To go quickly through these, self-pay, clinicians prescribe, patients buy on epicured.com. We've built up a network of thousands of what we call partners in health, registered dietitians, OBGYNs, PCPs, physical therapists, and even massage therapists that prescribe our food, where consumers can then design their own menu and have a dignified experience that they would expect from food as culture and food as medicine. Our early traction is really demonstrative in terms of our growth. We're approaching break even, and every level of unit economics beats all the benchmarks in our industry. Clinically, we've conducted research that validates our ability to control chronic disease. This is an example around irritable bowel syndrome. We've been named best gluten-free service for one of our menus by Good Housekeeping. We've been covered by many credible media outlets throughout the years. Our wholesale business line, we've rolled out. Right now, this week, we are launching our first kiosk on the campus of Mount Sinai Health System here in New York City as a part of their employee wellness program. And it creates more access points to care. And wholesale is strategic as M&A blurs lines in our industry. Retailers and pharmacists, insurers and payviders all look to use different types of wallets to change consumer behavior to improve health outcomes. For us, that ties into our enterprise business line. With only 7 months in market and no sales team, we have actively worked on 10 engagements representing 18 to 22 million in annual recurring revenue. And we're working and submitting claims with insurance companies as we speak. Importantly, our menu is dedicated to quality and equity. Contracted prices are as low as $7 to $8 per serving, which meets or beats any legacy institutional food providers. And we have one standard of care, no matter whether you're paying on your American Express card or it's being funded through an employee wellness or insurance program. Also importantly, our technology continues to deepen as we are building the first food as medicine data lake in the world to tie symptoms to promote further clinical research, enroll patients in clinical studies, and enhance our ability to serve the market. And to underscore the point, momentum is accelerating to fund food as medicine from the White House, NIH, Medicare, the Rockefeller Foundation, other waivers at the 1115 waiver, and many other government programs. We are raising our Series B capital round, a 15 million round led by a global institutional lead investor and an insurance company co-investor. We have 10 million circled and are seeking 5 more at what we believe to be a very fair price. We welcome all your questions and inquiries and hope to work with many of you in the future. Thank you very much.
Great job on the presentation, and congratulations on all the momentum with the company. I guess my question is, food could be like the most relatable thing for all of us, right? I mean, every day we're making decisions about our food. And I saw on the website, there's a big drive between like low FODMAP diet. What other disease states and conditions does Epicured support? And how are you able to do multiple types of therapeutic menus and really still maintain your margins and quality?
Absolutely. Well, we're really proud that we originated in the digestive disease market, which 15 to 20% of the US population has a lifelong digestive disease that we can support them with. Since then, we've expanded to diabetes, chronic kidney disease, cystic fibrosis. We're also working on clinical studies for childhood allergy and asthma, for instance. So we take any remit from our clients around the country, and we translate that into a program. We're designing a situation and engagement right now for 5 PACE sites in Massachusetts, looking to bring food on campus and in the home to support all those therapeutic journeys. How we do that is we have a proprietary facility, and then we also have a proprietary production supply chain. We call it our building blocks menu, which we can go into more later, but it allows us to plug and play. Everything's measured to the gram. We map it against all the chronic conditions, and then we can deploy fast and quickly, designed to suit.
One final question for you. So I know you've spent most of your career in healthcare. What do the margin profiles of this business look like? On its face, is it a food business, a healthcare business? And is the company cash flowing and profitable?
We're nearing break even and therefore also free cash flowing. So we're very proud of that. We're basically one of these clients away to then spin off free cash flow. So we're going to be there in 2024 and be able to invest the proceeds of the round in growth. Our margin profiles are shocking to most people. I know many insurance companies operate at 1% to 2% margins. Our EBITDA projections are 15 to 20%. Our gross profit margins are hitting 50%, and we're targeting 60% as we go forward. So it's a very attractive business, and we stand for quality from a culinary perspective and a quality and operations and execution perspective.
Yeah, so you look a lot like a premium tech-enabled services business.
Shockingly so, and that's what we like to underscore, right? In this whole dynamic, particularly as we develop the food as medicine data lake and partner with clinical research organizations and take other engagements on. Manufacturing and distributing food is but one part of our business model.